Hey, I'm Kara. I'm a mother-baby registered nurse, and I'm going to use this balloon to explain fundal massage to you guys and why we do it. So your uterus is a muscular organ, and after you give birth and your placenta comes away from the inside of your uterus, there's a dinner plate-sized wound from where the placenta came away, and that's where the majority of the bleeding and clots comes from. You can also have bleeding, like if you tear or anything, like in your vaginal area. But I've had a lot of people say, oh, well, I have a C-section, so like I'm not going to have any bleeding, but you will still have bleeding even with a C-section because you still have that area where your placenta came away. So your fundus is the name of the top of your uterus. So pretend this is like your lower belly down here. We put a hand down here to brace it, and we use our other hand to massage the top of your uterus, and we want to feel it start to contract. When it contracts, that helps reduce the amount of bleeding from where your placenta came away, helps expel any clots that could be in there that could prevent your uterus from contracting like it needs to. We're looking to make sure it's not boggy, which means like when we push on it, it's kind of like mushy and soft. We want to feel it start to contract because that's a good sign. If it's really boggy and not contracting and you're just like bleeding, that's when we worry about like you could have a hemorrhage. Every hospital is different in the frequency in which they do these, but typically they're most important in the first 4 hours because that's when your hemorrhage risk is just the highest. Follow me for more postpartum tips.